Hey guys, my name is Blake LeVine. I am the author of the book Beating Bipolar and also an advocate and survivor of bipolar disorder. In this video I want to talk to you about bipolar and addictions. Listen, for anyone that faces severe addictions, it can pretty much take away all of your strength and potentially end your life. Addictions to cocaine or heroin or alcohol can be so severe that they take away all the abilities and things that are within you. Now, part of the problem is it doesn't start, that you wake up and one day you're addicted. You start maybe drinking a little bit, which leads to drinking a lot, or you end up doing a drop of cocaine to end up needing it every day. Part of the problem with really bad addictions is the things end up taking over your life. I've met people with addictions that all they are looking to do is score their next hit. They just want to get the thing that they're addicted to. Now, part of the problem is if you face a mental illness on top of this, you're now facing two really, really tough, challenging situations. So they call this dual diagnosis in the mental health community because you have literally two diagnoses. One is the mental illness and one is the addiction. So what I would say to you is if you're facing bipolar and you have addiction, you need to go out there and find support. Get a psychiatrist, get a doctor that understands this, because part of the problem is the medicines you might take for bipolar, if you are drinking or doing drugs, can really harmfully interact with each other. So you're basically playing Russian roulette if you're using lots of drugs or alcohol and taking medicine and not being monitored. You're really setting yourself up for a problem. So go out there, find a good psychiatrist, find a doctor. There's a great site called Psychology Today that has a directory of all the doctors and psychiatrists and therapists who are in your area and tells you about the different insurance plans they have and what they cost, and it would be a great thing. Now, if you have someone you care about or love that has addictions and bipolar, you want to make sure that you step in and you try to help. You might see them sinking and falling, and it's sometimes the person that cares about them or loves them says, listen, I want to see them get better. I want to see them get their life together. And just basically looking that person in the eye and saying, I love you. I want you to rebuild your life. You can't stay in this way, having these addictions and having untreated mental illness. We could work together to get you the help that you need. And I, as a life coach, have had many family members call me up to work with those they care about, and I sometimes give them the hope and the encouragement and tools to take the next step. So I want to say to you, if you're facing bipolar and addictions, there are hope. I've met people that have overcome, that have been able to quit their addictions and live in a healthy way with bipolar, but it takes work. And if you'll take small steps by going out there and finding a doctor or a psychiatrist and working on these issues, you will definitely see a lot better of an outcome. And even if it's going to rehab for a certain amount of time, those 30 days that you're there might just save your life. It might stop you from overdosing or losing your life, because many people with bipolar have strong minds and abilities, and if they break the addiction to substances, they can end up going on to recover and being successful. I want to thank you for watching this video. We have amazing, great clips about bipolar and other topics to inspire you and motivate you and get you excited about your life. And I also wrote a book called Beating Bipolar. You can find it on Amazon or any other bookstore. It's a great guide for families and individuals to learn more about bipolar, and I also share my own story of nearly dying from mental illness and how I would go on to help many people. Thanks for watching this, and I hope you have a great day or night wherever you are. Bye-bye.